I have some breaking news, not only about my hospital visit, but about something that just recently was actually on the news in Brookings, Oregon. So the breaking news about my hospital visit is that I received a bill for $6,214 for that hospital visit. My health insurance paid $4,986.20 of said bill, leaving me with a balance of $1,227.80. That's what they charged me to be berated by an idiotic doctor and get CAT scans that I never got the results of. The next piece of breaking news is actually from the real news, as they call it. This story is from the Wild Rivers Outpost, an offshoot of the Lost Coast Outpost. Apparently, they don't only have a local newspaper for Humboldt County, California, but they also have an offshoot of their local newspaper for Del Norte County, California, and Curry County, Oregon, which are considered to be one area by many of the locals who live there, even though they're in different counties and different states, because the two biggest cities in each county, Crescent City, California, and Brookings, Oregon, are only like 20 miles away. And the rest of the counties are basically like rural areas. Anyway, this article says 21 staff patients at Brookings Senior Living Facility have tested positive for COVID-19, Curry County Public Health reports. And unfortunately, one died. So I was about to tell this story to my friend, but I realized that I wanted to tell this story to everyone. And I realized that telling the story to my friend and then repeating it later in a video would be like absolutely ridiculous. I really only want to tell this story one time. So I'm going to tell it one time to my friend who is sitting in this room and also to you and everybody else. Back in August, I was trying to get some abnormal lumps in my body x-rayed, and I went to several hospitals in Humboldt County, California, and was unable to get these lumps x-rayed and get a diagnosis of what the lumps were. And I was particularly concerned that these lumps might be cancerous. So after going to 2 hospitals in Humboldt County, California, I had not only not received a diagnosis as to what these lumps were, but one of the hospitals had put me in a waiting room for many hours with a bunch of people who were coughing, who were being tested for COVID-19. And I had ended up getting sick and wondering if I had caught COVID-19 at that hospital. At that point, it was impossible to get tested for COVID-19 in Humboldt County, California. So I ended up going to the California-Oregon border. I got tested for COVID-19 in Crescent City, California. Then I went to a hospital in Brookings, Oregon, about 20 miles north of Crescent City, to attempt to get the lumps checked to make sure they were not cancerous. When I arrived at said hospital, I was asked at the entrance to the emergency room if I had any symptoms that could be COVID-19. I told them that I did and that I had just been tested for COVID-19. I was put in a separate part of the waiting room designated only for people who had COVID-19 symptoms, and then taken to a room where I was in a room with another patient. We were divided by a curtain, and the patient was a woman being treated for some kind of heart attack. While I was waiting for the doctors to see me, that woman asked her doctor what the difference was between a medication she was being given and another medication that she had just been given. And the doctor told her, "I don't know. It's just something we give to people in the ER when they're having heart attacks. Not only did I already know the answer to her question, but I also know how to use like Google and would have been able to answer her question if I didn't already know the answer. Then the doctor came into my room, and by the way, it was a different doctor, but the only difference between my doctor and the other lady's doctor is that hers was a man and mine was a woman. That was where the differences ended. Their personalities and attitudes were quite similar. I described to the doctor the lumps in my head, neck, shoulder, breasts, and spine and private parts. And then the doctor said, I think that the problem is that you're feeling the lumps and that you just need to stop feeling the lumps and just go on and live your normal life and be happy and like try to enjoy yourself. I then like begged the doctor to do some kind of tests, x-rays, CAT scans, MRIs, a biopsy, anything to make sure that these lumps that I was feeling were not cancerous. And then the doctor said, really rudely and sarcastically, well, if you really want me to, I could order x-rays and irradiate your pelvis, trying to x-ray it to see if there is cancer there. And I could order a mammogram and irradiate your breasts, trying to see if there's cancer in them. And I said, please, please, please do this. I'm really scared that I might have cancer. I really want to know if these lumps are cancerous or benign, and even if they are benign, I might want them to be removed because they're painful. The doctor then ordered some CAT scans, and then they had some kind of computer crash, said they lost the results, and I have not yet been able to get them, and it is October. While I was at this hospital, I became very concerned that they were not being safe about preventing the spread of COVID-19. I mean, for goodness sake, I told them I might have COVID-19 when I got there, and they put me in a room with a lady who was elderly and having a heart attack. But then when they had their computer crash, like everybody in the entire hospital suddenly was in the hallway right outside of the room I was in, and I could see them through a glass door. And I tried to discreetly take some pictures. I will show them to you. Here they are. As you can see in these pictures, there are people, both staff in the ER who are normally in the ER, and people from the technical department who are there just to try to fix their computers. And you can see that they are either not wearing masks or have their masks pulled under their chins. I'm sorry about the poor quality of these pictures. I was trying to take them like sneakily because I didn't want to get in trouble for taking them. But now you have seen what I saw when I was in the ER. Anyway, I have some breaking news, not only about my hospital visit, but about something that just recently was actually on the news in Brookings, Oregon. So the breaking news about my hospital visit is that I received a bill for $6,214 for that hospital visit. My health insurance paid $4,986.20 of said bill, leaving me with a balance of $1,227.80. That's what they charged me to be berated by an idiotic doctor and get CAT scans that I never got the results of. The next piece of breaking news is actually from the real news, as they call it. This story is from the Wild Rivers Outpost, an offshoot of the Lost Coast Outpost. Apparently, they don't only have a local newspaper for Humboldt County, California, but they also have an offshoot of their local newspaper for Del Norte County, California, and Curry County, Oregon, which are considered to be one area by many of the locals who live there, even though they're in different counties and different states, because the two biggest cities in each county, Crescent City, California, and Brookings, Oregon, are only like 20 miles away. And the rest of the counties are basically like rural areas. Anyway, this article says 21 staff patients at Brookings Senior Living Facility have tested positive for COVID-19, Curry County Public Health reports. And unfortunately, one died. If anyone is wondering how COVID-19 got into that nursing home, remember that story that I just told you? That time I ended up testing negative for COVID-19, but when I went to the hospital and said that I had just gotten tested and had symptoms, like, I didn't know that, and neither did they. If I had had COVID-19, the doctors and the nurses and the people from the technical department and that elderly lady who was in the same hospital room as me could have caught it from me. I wouldn't be surprised if one of the patients from that nursing home went to that hospital for like a routine visit, which for an elderly person in a nursing home could be like a heart attack or something, which is relatively normal for elderly people to have. And they caught COVID-19 there and brought it back to the nursing home. Or perhaps somebody works in that hospital, isn't careful about wearing a mask, came in contact with somebody who had COVID-19 in the hospital and brought it back to the nursing home where they also work, because a lot of nurses work at hospitals and nursing homes. Nurses don't make a lot of money, so a lot of nurses take second jobs. Anyway, I just wanted to share my story because when I read that article, the first thing I thought is, how did it get in that nursing home? Oh, I bet it got in there through carelessness. And then I remembered how they thought I might have COVID-19 and put me in a hospital room with an elderly lady having a heart attack. I am now going to end this video with a message to the people of Del Norte County, California, and Curry County, Oregon. I was shocked by like how many people in both those counties were like not wearing masks or wearing masks under their noses. And when I went up there, I tried like really hard to stay away from people because I thought I might have COVID-19. And at one point when I tried to put on a mask, somebody yelled at me and insinuated that I was stupid and told me to take it off while I was there. My message to you people is, please be very, very careful, because 21 cases could become like 2,100 or 21,000 cases like very, very quickly. Just look what's happening in the rest of the USA. With that said, I am now going to end this video. Please like this video, share this video, watch my other videos, and subscribe to my channel. And if you would like to help me to make more videos, you can. You can help me by donating money to me on Patreon or other sites, or buying things for me, or for my family, or my pets. Thank you for watching this video. Bye, people.